Jamnagar Medical College, and sir is PSM, PG, PhD, ME. He resides at Green Avenue, where I reside. I am very happy to say that he is my neighbor. Currently, he is working as a professor at a very young age. He is below 40. He is working as a professor, community medicine at Pramukhswami Medical College, Karamsad, Anand. I have already shared his educational qualifications. To his credit, he has many awards, many achievements. He has been awarded Kaluram KM Memorial Award for Best Scientific Paper presented by a young male scientist in the annual national conference at IAPSM at King George Medical University, Lucknow in 2015. He was awarded the first prize in paper presentation
कॉल पर कॉल
the
કર્યા
11th annual conference, Gujarat chapter at Pramukhswami PNSM Shivsha Medical College. I request other participants to please mute. I can see there is some female voice. Please mute. He has delivered a live online lecture on COVID-19, epidemiology, prevention and control to Gokul Global University recently in 2020. Many awards, many achievements are there. It may take, he to his credit, no, there are many, more than, I guess, 27, 28 publications are there. He has been an expert in conducting many trainings and workshops. He himself has attended many workshops. He has taken up many projects on medicines. In the field activities also, he has been very active. He has attended many national, international conferences in Gujarat and elsewhere as well. And international conferences are there to his credit. So a lot many things to say about Dr. Sharma. But considering the time constraints, sir, I would just say that today we are going to listen to a person who has excelled in the area of medical sciences. And sir, we are very happy to welcome you. And over to you, sir. Please proceed with your topic, health and hygiene.
Thank you, Dr. Mayu sir, for giving such a nice introduction. I am also thankful to Vasudevan sir, Dr. Anil sir, Dr. Rajnikant Rodia that this opportunity is given to me, and I am here before you through online mode. But at least I am having this opportunity to discuss an important topic like health and hygiene awareness. So in next say 50 minutes to 1 hour, we will be discussing this. And when we are saying this current pandemic, this health and hygiene ultimately becomes a important topic by itself, because nothing needs to be told, but you can see it around you that hygiene, if it is, then the disease can be prevented. And these are the simple measures which can be taken, and forget about medicine and other thing, but just by following or observing certain hygienic measures, we can prevent the disease. And as the age old saying is there, that prevention is better than control. So it's a very important topic, and let's discuss this. So after the end of this presentation, the participants will understand the relationship between health and hygiene. And after this understanding, there should be an enhanced approach for practical applicability. Overall, the presentation in this, we will be discussing about some of the historical aspects, like how this hygiene concept came, what is health and what is hygiene, epidemiological triad of diseases, diseases like communicable and non-communicable diseases, and the role of hygiene in that, health in relation to hygiene, why is it important, and hygiene seen in a broader aspect, personal as well as environmental. Okay, so when we are going to see about the historical aspects, it's not that recently the hygiene as such is given importance, but you can see that it is of importance from the very past. So he is Charak, the father of Indian medicine, importance of hygiene. So ultimately hygiene in terms of purity of mind, the clean body, clean water, clean environment. So it's not only means the hygiene which is ultimately the hygiene which is very important to measure, and it's not only the controlling of disease, but by using or following the simple hygienic measures, we can prevent the disease. So in age old, also in history, it has been mentioned in Charak Samhita, this is mentioned clearly that it is important to combat the disease as well as to prevent its occurrence by measuring simple hygienic measures. Then this first photograph is of Ignaz Semmelweis. He was a surgeon actually, and he founded that by simple hand washing, the maternal deaths can be averted. At that time in England, the medical students directly after conducting or after attending the post-mortem, they used to just see the antenatal cases, and in that means they did not used to wash their hands and directly they used to touch. So there was something on the hands which actually transmitted the disease agent from the dead bodies to these pregnant women. So he actually led the studies and he found it that there is something on hand. Actually, these are very old things in the 17th century. So at that time the germ concept was not there. So it was not found actually what is there on the hands, but he propounded this theory. But ultimately at that time this theory was not well known. So there were so many opponents, they refuted this hypothesis, and ultimately he had to die without having support for his evidence or support or evidence in his support. So, but a century later, it was found that what he told at that time, it was perfectly right. So it's not that means currently the scientific evidence has to be there, and it's not that exactly scientific evidence if it is not there and if germ is not found, but still like some evidences, some hypothesis can be found. So Ignaz Semmelweis propounded this hypothesis, but he was not able to gather that evidence, so it was refuted. Then second photograph is Edwin Chadwick. He was actually a very rich person, and he was from England, and he is given the credit of the first person who actually thought of disease in terms of sanitation, that if sanitation is not maintained, disease can occur. And he actually founded this particularly in the laborers community, the dwellings where these were residents as a means the dwellings or the residential area or the colony where the laborers used to be there, the disease proportion was very high. There used to be frequently skin diseases, respiratory diseases, tuberculosis and cholera and the waterborne epidemics. So he actually founded that if such things are taken care, the sanitation is properly maintained, then such diseases will not occur. So Edwin Chadwick is considered as the first person who actually thought of disease in terms of sanitation. Then this photograph is of John Snow. I think recently this question also came in KBC. John Snow is considered as father of public health, and he related cholera with the cholera as a disease which can be transmitted by water. So at that time he was basically an anesthetist. So he just did an epidemiological study in London and in Soho, and he found that there is something which is linked. There is something as a linkage between cholera and water. So he, based on his experiments, based on his spot map experiments, so he founded that cholera is a waterborne disease. No doubt, right now we know that cholera is a waterborne disease, and if water is contaminated by Vibrio cholera, then the cholera can occur. But at that time, all these things were not known. Right now we know that malaria is transmitted by the bite of Anopheles mosquito. But at those times were there then when nothing was known about such things. So at that time, this identification was very important. So when John Snow found that cholera is something to do with water, am I audible? Is it clear?
Yes, sir.
Yes, sir. Yes, sir. Absolutely.
Yes, sir.
Okay, fine. So when John Snow founded, and again, opponents were always there. So his own, we can say senior, William Farr, he refuted, but his evidence was so strong that they actually thought that yes, cholera is actually having some linkage with water, and that time then that particular hand pump through which that water supply was there, that hand pump handle was taken out, and still it is there in this Soho, London, and besides this museum, John Snow Memorial Museum, and that hand pump is there without the handle, because just by his observation, when he gave his suggestions, their handle was removed from hand pump, and then the cases were suddenly reduced. It was his great finding. So again, hygiene we can see here. So proper hygiene was maintained, the water quality was made proper, and that particular water supply which he thought to be contaminated with the cholera, that was stopped. So cholera was again stopped as an epidemic in that particular area. Then this next photograph is of Ronald Ross. So Ronald Ross, he actually identified that malaria is transmitted by the bite of female Anopheles mosquito. So again, earlier at that time, malaria was thought to be a disease which is actually transmitted by bad air. That's why the name is malaria. MAL means bad and ARIA means air. So bad air, which actually makes person sick. So at that time, this was thought that malaria is transmitted by bad air. But he told that no, malaria is transmitted by the bite of female Anopheles mosquito. So he did all his experiments in India, in Sikandrabad, Hyderabad. This is the hand pump which I was talking about for John Snow. You can see that handle is not there, and besides that, that building is John Snow Memorial Museum, and this is the hand pump. This is Broadwick Street in London. Okay, having some of these historical aspects, now we move ahead. We see that what is the definition given by WHO, which is considered as the premier organization which is working for health. According to WHO, World Health Organization, health is a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. So here the WHO defines health as a complete physical, mental and social well-being. So not only the physical health which is important, even though physique is good means a sound body, everything fine, but if mental health is not good or the person is not very social, again social, I am not going in much detail, like personalities are there, introvert, extrovert, everyone cannot be extrovert, but social means totally alienated and doing some of the things which are not acceptable by the general norms of the society. So I'm talking of that. So complete physical, mental and social well-being, and not merely the absence of disease or infirmity. So just the absence of disease, we cannot say the person is healthy. So all these three important parameters must be met: complete physical, mental and social well-being, and not merely the disease, absence of disease or infirmity. So that is the definition of health which is given by WHO. And now coming to hygiene. Hygiene is a series of practices performed to preserve health. So according to WHO, hygiene refers to conditions and practices that help to maintain health and prevent the spread of diseases. So hygiene is in a broader concept than cleanliness. Actually both these are considered as synonyms, but actually it is not. Hygiene is a very broader term. It includes cleanliness, right? So hygiene, it can also be talked in terms of discipline, like if someone is doing exercise, not eating tobacco, not smoking, not drinking alcohol, so that is again a disciplined body, and that again refers to practices that is actually maintaining health and prevent the spread of the diseases. Yes, this everyone must have seen on the cars or two-wheelers of doctors. So this is again a part of this historical concept. Greek god Asclepius, and this is the symbol, the Greek god of medicine Asclepius, and their staff, they are represented as serpents, these two serpents, and he had actually two daughters, Panacea and Hygiea. From Panacea, actually the curative medicine has actually evolved. Panacea is cure and Hygiea is hygiene. So Hygiea is ultimately into preventive medicine. So curative medicine, preventive medicine, Panacea is cure, Hygiea is prevention. Now this is one of the very important triads which we are always talking of, the epidemiological triad. So this triad is describing the role of host, agent and environment. So host here is a human being who can get the disease, right? So agent here is the disease agent which is causing the disease. And environment must be conducive to start that particular disease. So if the environment is not there, which is actually supportive to the disease causation, the disease may not be there. So there is definitely a role of environment, like say in very cold atmosphere or those areas where temperature is very low, you may not find malaria. In India also, you may not find malaria in this Himachal Pradesh and Sikkim and other areas. Again in Europe and America, where the region is quite cold, and in Canada, you may not find the malaria cases. So again, environment role is there besides the presence of agent and host. So this triad is actually very important. Whenever the environment is not conducive, even though the presence of host is there, agent is there, the disease may not be there, because one very good example is yellow fever. Yellow fever is caused by the bite of Aedes mosquito, the same mosquito which is actually causing dengue and chikungunya. The mosquito is abundant here. The mosquito which is causing dengue and environment is not conducive. So yellow fever is rampant in Africa continent, but it is not seen in India. India is a yellow fever free country. So even though host is there, agent is there, but environment is not conducive. So ultimately our topic is actually health and hygiene awareness. So now we are moving to that, having seen the basic historical concepts which actually has some path related to the hygiene. So communicable diseases and non-communicable diseases, we will be talking about this in terms of that. Okay. See this filth, this indiscriminate throwing of waste, just the segregation is not proper, and here the waste, solid waste is disposed as such, and this sewerage line, open drain line, again some people are seen in this third photograph. The woman who is fetching water, the water is quite dirty. So here the environment is not proper, and this is quite conducive for many diseases to occur, like waterborne diseases. Say typhoid can occur, hepatitis A can occur, hepatitis E can occur, then cholera, acute gastroenteritis, all these diseases can occur. And if water collection is there, then if clean water collection is there, then the Anopheles mosquito can breed in that. Again, if dirty water collection is there, say sewage water, cesspools, septic tanks, then Culex mosquito can breed in that. And Culex mosquito, I think in Gujarat also there are many cases in Saurashtra, that elephantiasis, जिसको हाथी पग बोलते हैं, elephantiasis cases are there. That is filariasis. In Gujarat, it is seen in Saurashtra region, particularly in Porbandar and Jamnagar also district is affected. Then Junagadh district. So here filariasis cases are seen. Filariasis cases, the filariasis is caused by the bite of Culex mosquito, and Culex mosquito breed in dirty water collection. Here dirty means sewage water or the septic tanks, cesspools, etc. So again, that is just a collection of bad water. So that is improper hygiene maintenance. That's why the disease is actually occurring. Again, we can see here so many mosquitoes, right? Initially the mosquito will lay eggs, then they will develop into larva, then pupa, and then adult mosquitoes, and then they will fly away, and then they will cause the disease. So this is just a improper hygiene which is maintained, and because of this improper hygiene, the disease like malaria, dengue, chikungunya, filariasis, kala-azar, leishmaniasis, everything can happen. These are all the arthropod-borne infections. So after rain, we are seeing so much of water collection. Again, because of improper drainage, many a times in societies, and again on the roads, if drain is overflow, then we can see that the mosquito breeding can be there. So again, that may give to so much of means disease, particularly the filariasis, and again unhygienic condition, unpleasant sight, smell. Okay. Then this one, sick building syndrome. Now the conditions may be there which may give rise to non-communicable diseases also, like say asthma, so pollen allergy, right? And this is because of the improper conditions at home, or this is termed as actually sick building syndrome. The sick building syndrome means is defined in a way that improper conditions, say dampness is there in the house, right? If AC is used, then improper ventilation if it is there, then too much of the air which is cooled, and if it is not opened on a regular basis, then this particular setting can cause disease like say allergic or this dust mite. Then we can see various influenza cases, avian influenza, West Nile virus cases, SARS, severe acute respiratory syndrome. So this is all seen based on the sick building syndrome, because the closeness, say tower, there are different towers in a particular means in a colony or in a setup, residential colony. Now these towers are in such a way that there is hardly any space between these two towers, so air is trapped, and because of this air trapping, that circulation is not maintained properly. So it can give rise to a sickness where the person may feel nauseatic, where the person is not feeling well, just I'm not feeling well, like this type of feeling is there in the sick building syndrome. Certain closeness, this type of feeling is there. So this is just named as sick building syndrome, and scientists have studied a lot about this. So it can give rise to communicable diseases as well as non-communicable diseases. Communicable diseases like SARS, avian influenza, and non-communicable diseases like allergies, dust mite allergies, and various different forms of skin diseases also. Okay, again, because of the poor hygiene and particularly the area from where the water is taken, that can again determine the gastrointestinal diseases. So we can see so many photographs here. Some photographs are taken from, these are photographs from India, some are from the African countries. Actually, we can stop the cycle of diarrheal diseases. Again, it's not exactly, we will be seeing this in other slides to come, that hygiene is basically of self also and environmental hygiene. So ultimately, the responsibility may lie on self, but again there are certain things which are called as social determinants, which also lay the foundation of particular disease. So if the water supply is taken, then water supply is something which is actually taken care by government. So if proper water supply is not there, then definitely it can give rise to the gastrointestinal cases. And again, all these are communicable diseases. Again, if family condition is not proper, the utensils which are used, if that is not particularly washed or cleaned properly, then again it can give rise to diarrheal diseases or episodes of such type, both in adults as well as children. Okay, then this is some like personal hygiene, dental hygiene. Again, it's very important. So this is actually coming as a non-communicable disease. If dental hygiene is not maintained properly, it can give rise to so many diseases related to teeth, dental caries, and ultimately it can also, if that goes on a severe way, the teeth which are actually involving the suboral mucosa, and the disease of like the dental caries which is there and which is actually spreading to mucosa, oral mucosa, then it may give rise to cancers also. So dental hygiene again important. Personal hygiene, here we are just the first three photographs are of poor dental hygiene, and here this is also a very common problem in children, the louse infestation. We can see again the louse infestation. Normally it is seen if the child is not bathing properly, and poor hair hygiene is maintained. So you can see that the child is scratching his head, so there is severe itching. The concentration is actually lost. The child is having some attention problem just because his attention is overall on the hair and itching is too much. So this is nothing but the personal hygiene. In personal hygiene, there are so many things which is coming. Dental hygiene is one. This oral bodily hygiene, like bathing daily, and maintaining the proper hair hygiene, the nails, the cutting of nails, because again, if the nails are not properly trimmed, then these are actually a source of infection, because in the nails, the ova and the eggs, they may be deposited, the germs, they may be deposited, and then this can be taken in through the gastrointestinal route, and this may cause so much of disease of different types. As I was talking about social determinants of health, like there are many conditions or many points which are in our hand, but there are many points, because no one actually wants to be unhealthy, or no one wants to actually be in a setting or in an atmosphere which is filthy. So everyone wants to be there in a very good atmosphere, but there are certain conditions. There are certain conditions which actually give a compulsion, like say here in the last photograph, this child is there, so he has to live there, and same way in Dharavi slum also, and there are, means apart from Dharavi, there are urban slums everywhere, so the condition is quite pitiable. So ultimately, whatever is in our hand we can do, but there are certain conditions which are to be taken care by the government. Definitely there must be community participation. Whatever is done by the government, the community has to participate. So first willingness should be from the community. They can contribute a lot. So if the contribution is there, ultimately the unhygienic condition like the collection of garbage is accumulated by the people only. So they must do something. They must have a call that it is causing the disease, so we must prevent it. So there are social determinants, and one of the very important social determinant is poverty. So this second photograph is of Delhi. Poverty is actually bringing so many diseases with it. So poverty leads to unhygienic condition. All this is a vicious cycle, and to break this cycle, there needs intervention. So intervention can be by awareness. This is actually the topic, awareness. So awareness is actually a conscious attempt. It is just like opening up of eyes and seeing all around us that what we can do. And when we are aware, then only we can do something. And if we are ignorant, so just opposite can be turned as ignorant. So if we are not aware, that means we are ignoring. And when this consciousness can be there, nobody knows, because ultimately it's just a conscious effort towards the ill goings in the society, that something can be done on the positive side. This is again improper hygiene, like just when a person is coughing or sneezing, this much amount of microbes, whatever the virus or bacteria that particular based on the disease, so this much is released. And right now when we are saying in corona, maintain a distance of 1 meter, and to be on the safer side 2 meters, so this is the reason actually, the droplet infection, the airborne transmission, so it can be prevented. See, this much, when a person sneezes, this much is the amount of virus or the bacteria. Here in coronavirus, it's virus. It depends on disease, like in TB, it's bacillus, it's bacteria. So this much quantum of virus or bacteria, it is released in the atmosphere, and when the person, and these are not visible, this is by microscope, scanned by electron microscope, this particular photograph is taken. Then this person in front of you may not be visible, means may not be seeing all these microbes in the air, but you can see, you can imagine that whenever the person in front is inhaling all this, and it can give rise to disease. So this is one of the photograph for improper hygiene, like this is known as cough etiquettes. Whenever a person is sneezing or coughing, at least use handkerchief, and right now we are all using mask. So proper following of precautionary measures, that is must, and that is nothing but awareness. So disease prevention and control. So these are all the photographs particularly important for corona, or not only for corona, all the respiratory tract infections. So you can see step by step, like sanitizing the things which are actually used by a person, hand washing, maintaining a distance of 2 meters, Same with the second photograph of door latch is again like hand washing, this washing of that particular door latch once it is used, use of gloves, then sanitization of hands, using of mask, and whatever the things which are used, just sanitize it, right? So disease prevention and control at different levels, everything is important for arthropod-borne infections, that like malaria, dengue. Again, the disease prevention is more important, like preventing the self and preventing the environment. Levels of prevention, when we are talking of awareness, the levels of prevention, it may be like primordial prevention, primary prevention, secondary prevention, and tertiary prevention. Primordial prevention is the ultimate because that is the first one, the primordial prevention. As a means as a professionals, as a faculty in a college, we all can educate the children that what is the importance of hygiene, what is the importance of good habits like doing exercise daily, not to eat tobacco, not to drink alcohol, and what can happen if these things are followed. So this is nothing but primordial prevention. Talking about good habits, if the children are following it, then it comes into practice, then only it will become a habit, and then things can be averted, like means diseases can be averted. So this is the primordial prevention, and primary prevention is disease not has occurred yet, but prevention of the disease in pre-pathogenesis phase. So both these are important. The most important, primary prevention and primordial prevention. Secondary is definitely it as the disease has occurred and then you are stopping the progression of the disease. And tertiary prevention is like the disease has occurred and some damage has also taken place in the body, and then you are just doing some rehabilitation. That is the tertiary prevention. So why to go till that particular point, tertiary prevention? Why not the primordial prevention, that is inculcating the good habits, and parents their role model for their children, their wards. So just to teach them, rather than teaching just what we are doing, they will just observe and follow it. So not only for corona, but all the respiratory tract infections, respiratory borne diseases, so that can be prevented by using simple preventive measures, simple precautionary measures like using the handkerchief, and while coughing, while sneezing. Same way, maintaining a distance from a person. Like if I am diseased, then I myself say that I am diseased, and you just stay a little bit away. If I am all right but having just disease, so I may not be interested in transmitting, or I am not wishing to transmit the disease. So just I myself is that much aware that I will use the handkerchief or the mask. Same way, the washing of hands properly, it's for all respiratory tract infections. So washing of hands properly, maintaining a social distance, using the handkerchief, face mask. So these are the simple measures. Again, when we are talking of health, see in the second photograph, the patient is asking like, so if I take this medicines, can I stop the antibiotic and other medicines? The doctor is saying, no, you need to continue that. So this is again important. Just sudden discontinuation of the drugs, again it may give rise to problems, like in particularly in tuberculosis, when we are saying just stopping the drug after say 3 weeks, when the person is feeling fine, it can give rise to drug resistance. So following the advices of the doctors properly, likewise in corona also, when the doctor is saying to go for isolation, to go for quarantine measures, then just follow it, so that will be good. So these are all the basic steps or basic like advices which are given and which needs to be followed. If that is followed properly, we can maintain good health. So proper disposal of waste. Again, waste again is not only giving rise to improper this disposal is not giving rise to poor sight appearance, but also welcoming the insects, then worms, mosquitoes for that particular breeding. So proper disposal of waste must be there, and again it can cause injuries also. Say sharp waste is there, a scalpel, needle is there, and if that is taken by any person, so that person can get blood-borne diseases like hepatitis B, or even like hepatitis C. So this can be there. So government of Gujarat is made this a method that the disposal of waste can be like wet waste and dry waste. This is again a good initiative by the government. So segregation of waste is very important. By just segregating the waste, we are seeing that we are contributing towards the, or we are participating in the government programs, and we are helping them actually, the garbage collectors, so that directly they can put the bins, the final for disposal. So in this way, we can definitely help, and we can prevent the diseases, and we can again prevent the unhygienic conditions. So this is just for the prevention of malaria. Actually, you can see the persons, they are in both this photograph. In one, that person is spraying the insecticide, and here that person is filling that particular, exactly, it is not exactly a drain, but that pit, he is filling that so that mosquito breeding is not there. But also the community can participate. It's actually there in the community settings. So no doubt it's the job of government. The government officials, the government people may come for this, but community participation is an important element of primary healthcare. And whenever the community participates, this program is successful. So just by maintaining a good mood, sound health, proper mental health, a positive thinking, having a positive energy, and ultimately thinking of in a vibrant mood, happiness, sanitation, cleanliness for a healthy environment. And so these are all the measures which we can adopt to prevent the disease, maybe communicable disease, non-communicable disease. So if we are talking about the mental health, actually this mental health is also in the definition of the WHO's health definition. So mental health is one of the integral component. So when we are thinking good, when we are positive, when we are happy, so we are thinking of good for the community. So ultimately it's important eating nutritious food and increasing the immunity. Immunity is also talked much in the corona infection. So eating good food, vitamin C rich foods, and uh, following the proper Ayurvedic advices, like the Ayurvedic advices are there, the homeopathic medicines were also prescribed during this corona epidemic to increase the immunity. So all this, whenever the immunity is there, the person may fall, means sick in lesser number, or frequency will be reduced. So ultimately it's a vicious cycle. A poor body or a poorly malnourished person will fall sick early, and the frequency will be more. This actually happens in case of children who frequently fall victim to the gastroenteritis cases. And again, the vaccine preventable disease like measles, the outcome may be very severe if the child is malnourished. So having a proper diet, proper nutrition, maintaining good hygiene, having a good water supply. Actually, again, all this can be a part of awareness. Some simple measures, the government is doing a lot. Say if hygiene is, if water is not pure, but the government is giving chlorine tablets, so that these tablets are available free of cost from the government supply. And at PHC subcenter, the female health worker, the doctors, they are giving the chlorine tablets, which needs to be poured in 20 liters of water, one tablet. So just by simple measure, but the thing is the person should be aware so that he can ask for it. So that is important. And just by drinking water, pure water, there are so many diseases, so many gastroenteritis problem can be avoided just by drinking pure water. All these gastroenteritis, normally the gastroenteritis cases, except the food poisoning, they are actually occurring because of poor quality food or poor quality water. So if water or food, particularly in case of typhoid, if they are contaminated, then definitely the disease can be there. So sanitation is ultimately the key. Mahatma Gandhi ji has already laid so much of importance on cleanliness. We ourselves has to clean our surroundings. We ourselves needs to be clean by means daily. So self cleanliness and environmental cleanliness. So hygiene here we can see is two important parts: the overall personal hygiene and the environmental hygiene. Both contributes to disease. And when we are talking of environmental hygiene, it can reach to masses. So No doubt, personal hygiene is for self, but environmental hygiene, it is reaching to mass. So the mass problems, the public problems can be averted. So sanitation and cleanliness is a key for a healthy environment, and ultimately it's a key for a sound body, a body which is disease free. Okay, I stop my presentation here. Hello.
Ji, Professor Sharma, it was really indeed a very fruitful presentation. You started from Charak Samhita. You also talked about communicable, non-communicable disease. At what level an individual and in a mass we can uh, take care of our personal health and hygiene, and of course the mass hygiene. You also very well differentiated between these two terminologies, health and hygiene. Sir, it was really informative. Thank you very much. But for the formal vote of thanks, I invite Dr. Maunas Thakur, a senior faculty. Maunas sir, I invite you, sir, to propose the vote of thanks. Over to Dr. Maunas Thakur.
Okay. So, respected principal, sir, invited guest, Professor Deepak, sir, and all the faculty members and students. Today is the second day of the lecture series organized by IQAC, and I am highly thankful to the today's speaker, Professor Deepak, sir, who really made us aware of the whole history of diseases and how the diseases are spread, how should we maintain the hygiene, and all such things told by him are really very important because sir, the students who are participating in this lecture series are the B.Ed students who are going to be teachers, and your message will be, you know, will go to thousands of students in future because these are the teachers, and if they are aware, they will make others aware also. I heartily thank you for allotting this much of time in order to spread awareness about health and hygiene. And it was really a very nice presentation, and we learned a lot from it. Particularly in these COVID-19 situations, such kind of awareness is very, very important for us. And uh, I again thank you for sparing some time for the teachers and future teachers. I thank the principal, sir, who gave this opportunity to organize this lecture, and the coordinator of the IQAC, Dr. Anil Barsad, sir, for organizing all the event. Thank you, Rodia, sir, for organizing these technical support, and Mayur, sir, for anchoring the whole program. Thank you, all the students who participated very actively. I know that you must have noted so many things. We are going to take a small evaluation test also after the whole series is over. So, with that, thank you very much, sir. Uh, with that, we shall conclude this session. Thank you very much.